Cancer doesn't always come with loud warning bells. Instead, it often whispers through subtle changes in your body that are easy to overlook. But ignoring those signs could mean missing a life-saving opportunity for early detection. In this video, I'm going to share critical signs of cancer that could save your life if you catch them in time. These are symptoms you might dismiss as minor inconveniences, but understanding them could make all the difference. If you notice any of these signs in yourself or a loved one, don't wait, consult a healthcare professional immediately. Let's get started. Persistent cough or voice changes. A persistent cough or voice changes might seem like a minor inconvenience at first, a lingering tickle in the throat or a slight rasp in your voice. But when these symptoms persist for weeks without improvement, they may be a warning sign of something far more serious, including lung cancer. Your lungs are highly sensitive organs, and cancer in this area disrupts their normal functioning. When a tumor begins to grow in the lungs, it may irritate the lining of the airways, triggering a chronic cough. Unlike a cough from a cold or allergies, which usually improves with time or treatment, a cancer-related cough tends to linger, sometimes becoming dry, hoarse, or even accompanied by blood. This happens because the tumor presses against or invades surrounding tissues, causing constant irritation. Over time, the body may also produce more mucus as a reaction to the tumor, which may make the cough feel wet or phlegmy. Voice changes, on the other hand, are often linked to throat cancer or cancer of the larynx. These cancers may directly affect the structures responsible for producing sound. As a tumor grows in or near the voice box, it may put pressure on the vocal cords or even invade them. This pressure changes the way your vocal cords vibrate, leading to hoarseness or a rough, strained quality of your voice. What's particularly alarming is how early this symptom may appear in throat cancer, often making it one of the first signs. The Cochrane Library Review found limited evidence for managing cancer-related cough. Brachytherapy and medications like morphine showed potential. Changes in bowel or bladder habits. Your bowel and bladder function are tightly regulated by your body, and disruptions in these processes may reflect significant underlying problems. One significant reason is bladder cancer, which directly affects urinary habits. This type of cancer typically begins in the cells of the bladder lining and may cause symptoms like blood in the urine, frequent urination, or difficulty emptying the bladder completely. As the cancer grows, it irritates or invades the bladder wall, leading to these changes. Blood in the urine, known as hematuria, is one of the most alarming signs and occurs because the tumor causes small blood vessels in the bladder to rupture. While the blood might not always be visible to the naked eye, it may still be detected during medical tests. Frequent urination or a sudden urge to urinate happens because the tumor irritates the bladder, creating a sense of urgency even when the bladder isn't full. These changes are often mistaken for urinary tract infections, which may delay proper diagnosis if not investigated thoroughly. The UEG Journal study analyzed 628 patients, with 22% having colorectal cancer. Anemia or bleeding significantly increased cancer prevalence, reaching 34% in patients 55 and older. Skin changes that don't heal. According to PubMed, the number of patients with skin cancer significantly increased. One of the most common connections between non-healing skin changes and cancer is skin cancer itself, particularly basal cell carcinoma. This type of cancer begins in the basal cells, which are found in the outermost layer of the skin. Basal cells play a crucial role in replenishing your skin, but when they are exposed to prolonged UV radiation, like from the sun or tanning beds, their DNA may be damaged. Normally, your body repairs DNA damage, but when that repair mechanism fails, basal cells may start growing uncontrollably. This leads to the formation of a lesion or patch that might look like a sore but doesn't heal, even over weeks or months. The persistent nature of this wound is a clear sign that the skin is being overtaken by abnormal, cancerous cells rather than regenerating properly. Another critical reason skin changes might point to cancer lies in melanoma, a more aggressive form of skin cancer. Unlike basal cell carcinoma, melanoma develops in melanocytes, the cells responsible for your skin's pigment. Melanoma often starts as a mole that changes in size, color, shape, or texture, but in some cases, it may also present as a new sore or patch that won't heal. Here's why: cancerous melanocytes grow deeply into the layers of the skin and disrupt the body's natural healing process. Instead of repairing the damage, the skin becomes inflamed or irregular, and blood flow to the affected area changes. This prevents healing and allows the lesion to remain or even worsen over time. Chronic fatigue without cause. Cancer-related fatigue and chronic fatigue syndrome are linked by a review in the International Journal of Molecular Science. The two conditions are linked by inflammation. One major reason for chronic fatigue is leukemia, a cancer that begins in the bone marrow, where blood cells are produced. In leukemia, the bone marrow starts making abnormal white blood cells that don't function properly. These cancerous cells crowd out healthy blood cells, including red blood cells, which are responsible for carrying oxygen throughout your body. With fewer red blood cells, your body doesn't get the oxygen it needs to fuel daily activities, leaving you feeling constantly weak and tired. This condition is called anemia, and it's a common consequence of leukemia. What's more, your body may also be working overtime to fight the abnormal cells, further draining your energy reserves. This double strain of oxygen deprivation and heightened immune activity creates a level of fatigue that can't be alleviated by rest or sleep. Another reason chronic fatigue might signal cancer is when it's caused by colon cancer, particularly in its earlier stages. Colon cancer often leads to hidden, slow blood loss in the digestive tract. This internal bleeding may not be visible to the naked eye, but over time it may deplete your body's iron levels and lead to anemia. Without enough iron, your body struggles to produce hemoglobin, the protein in red blood cells that carries oxygen. This oxygen shortage leaves you feeling perpetually drained, even if you're eating and sleeping well. What makes this type of fatigue particularly dangerous is that it may develop gradually, often without any other clear symptoms, until the cancer progresses further. It's a subtle, creeping sign that may easily be mistaken for something less serious, like a poor diet or a busy lifestyle. Unexplained lumps or swellings. Cancer begins when cells in the body start growing uncontrollably, breaking away from the normal cycle of cell life. Instead of dividing and dying in an orderly way, these cells keep multiplying, forming a mass known as a tumor. Now, not all tumors are cancerous. Some are benign and harmless. But malignant tumors, which are cancerous, behave differently. They invade surrounding tissues, disrupt the body's normal functions, and sometimes spread to other parts of the body. One classic example is breast cancer, where a hard or irregularly shaped lump in the breast or underarm might be the first warning sign. These lumps form because cancer cells clump together and create a dense mass. The tumor also causes changes in the surrounding tissue, making it feel harder or different from the rest of the area. Sometimes the lump might not even be painful, which is why so many people don't pay attention to it right away. That's the tricky part, because it doesn't hurt, it's easy to dismiss. But this small, painless mass could mean the body is trying to tell you something serious. Now let's consider another scenario: lymphoma, a type of cancer that affects the lymphatic system, which is part of your body's immune defense. Here, the lumps are swollen lymph nodes, commonly noticed in areas like the neck, armpits, or groin. Normally, lymph nodes swell when you're fighting off an infection, but with lymphoma, it's different. Cancerous lymphocytes, a type of white blood cell, multiply rapidly in the lymph nodes, making them swell. These swollen nodes may not hurt, which is why they often go unnoticed until they become visibly enlarged or start affecting movement or sensation in that area. According to a study from BJC, among 6,965 participants, 97% recognized unexplained swelling as a potential cancer warning sign, underscoring the importance of awareness for early detection efforts. Unexplained weight loss. Unexplained weight loss may occur through cancers of the digestive system, such as pancreatic cancer. The pancreas plays a vital role in producing enzymes that help digest food and absorb nutrients. When pancreatic cancer develops, it disrupts this process by either blocking the pancreas from releasing enzymes or by altering the body's ability to process fat and protein. This leads to malabsorption, where your body isn't getting the calories and nutrients it needs, no matter how much or what you eat. You start losing weight rapidly because your body is essentially starving itself at the cellular level. At the same time, cancer cells in the pancreas demand a lot of energy, further depleting your body's reserves and compounding the weight loss. The BJC study found that 2% of 63,973 patients with unexplained weight loss were diagnosed with cancer within 2 years, mostly late stage. Men over 50 and women over 70 were most likely to get it. Bleeding or discharge. Cervical cancer is where unusual vaginal bleeding becomes a key symptom. Cervical cancer typically develops slowly, often starting with precancerous changes in the cervix. As the cancer progresses, it begins to invade surrounding tissues and blood vessels, causing bleeding outside of normal menstrual cycles. This may include spotting between periods, bleeding after intercourse, or bleeding post-menopause. The mechanism behind this is straightforward, yet critical cervical tumors may erode nearby blood vessels, leading to irregular or excessive bleeding. As the tumor grows, it disrupts the natural tissue architecture, making the cervix more fragile and prone to damage. Moreover, there is colorectal cancer, which often presents with blood in the stool or rectal bleeding. In this case, cancerous growths in the colon or rectum disrupt the lining of the digestive tract. These tumors may grow and invade blood vessels, causing them to rupture and leak blood into the stool. Sometimes, this blood is bright red, indicating it's from the lower part of the digestive system, while darker, tarry stools suggest bleeding higher up in the colon. What's particularly dangerous here is that the bleeding is often slow and might not be noticeable right away. Over time, however, it may lead to anemia, leaving the person feeling tired and weak. The Journal of Women's Health study found significantly higher rates of postmenopausal bleeding and abnormal vaginal discharge in endometrial cancer patients compared to controls. These symptoms warrant urgent gynecological evaluation to rule out malignancy. Difficulty swallowing. Swallowing is a complex process that involves coordination between muscles and nerves in the mouth, throat, and esophagus. When cancer disrupts this system, it creates physical or functional barriers that make swallowing increasingly difficult. One of the most direct links is esophageal cancer, a type of cancer that develops in the esophagus, the tube that connects the throat to the stomach. As cancer grows in the esophagus, it forms a tumor that narrows the passageway. This narrowing, called a stricture, makes it progressively harder for food or liquids to pass through. Initially, you might notice trouble swallowing solid foods, like bread or meat, but as the tumor grows, even liquids may become difficult to swallow. Another potential cause of difficulty swallowing is throat cancer, particularly cancers of the pharynx or larynx. These cancers often begin as small, localized tumors but may grow to invade surrounding tissues and muscles critical for swallowing. Throat cancer may cause physical obstructions in the upper throat or disrupt the nerves that coordinate the swallowing process. This makes swallowing feel awkward, painful, or even impossible in severe cases. Additionally, throat cancers often lead to excessive mucus production or the sensation of something being stuck in the throat, further complicating the act of swallowing. Dysphagia and odynophagia, painful swallowing, are common in cancer patients. Most studies in PubMed on this complication are performed in patients with head and neck cancers, but swallowing disorders may also develop in patients with other malignancies. Swelling or tenderness in the breast area. The breast tissue is highly sensitive to changes in the body, and its response to disruptions like swelling or tenderness can be an early warning sign of underlying issues. Unlike other types that often present as a lump, inflammatory breast cancer begins with swelling and redness in the breast. This happens because cancer cells block the lymphatic vessels in the skin of the breast, causing fluid to build up and leading to inflammation. The breast may feel warm, tender, or even heavy, and the skin might take on a dimpled appearance, resembling an orange peel. This swelling isn't temporary, it doesn't resolve with rest or typical remedies, signaling that something deeper is wrong. The blockage of lymphatic vessels not only disrupts normal drainage, but also creates an environment where cancer may spread rapidly if left unchecked. One study identified arm swelling and tenderness as significant symptoms associated with lymphedema, highlighting their diagnostic importance. Unexplained pain or aches. Unexplained pain or persistent aches indicate cancer in the bone. Bone cancer causes intense discomfort because as the tumor grows, it disrupts the normal structure of the bone, weakening it and making it prone to fractures or breaks. The tumor also puts pressure on the surrounding nerves, sending constant pain signals to the brain. Unlike typical muscle soreness, this pain is persistent, deep, and often worsens at night or during physical activity. It may start as a dull ache, but gradually intensifies as the tumor grows and further damages the bone. The pressure and structural damage combined create a type of pain that the body cannot naturally resolve, making it a glaring warning sign. Furthermore, in ovarian cancer, you may also feel pain in the abdomen or pelvis. This pain occurs because the growing tumor exerts pressure on nearby organs like the bladder or intestines, creating a sense of fullness, discomfort, or cramping. As ovarian cancer progresses, fluid may build up in the abdomen, a condition known as ascites, which further stretches the abdominal wall and causes additional pain. The National Library of Medicine review highlights the complexity of cancer-associated pain arising from tumors or therapies. Diagnosis requires ruling out other causes through a thorough evaluation. Thank you so much for staying with me through this important video. I hope you now feel more aware of the cancer signs that could save your life. Remember, your body is constantly communicating with you. It's up to us to listen. If you notice anything that resonates with what we have discussed, don't ignore it. You owe it to yourself and your loved ones to take action. Early detection may truly be the difference between life and death, and it starts with knowing what to look for.